Okay guys, so today we are doing 12 leads and we learned about placement, where to place them properly and accurately. Understanding the proper placement is essential to getting a proper EKG for our patient and for our documentation as well. When interpreted accurately, an ECG can detect and monitor a host of heart conditions from arrhythmias to coronary heart disease to electrolyte imbalance. Okay guys, so we're gonna adjust our patient accordingly, have them sitting in a comfortable position, preferably at maybe 45-degree angle. If you can get them flatter, that's fine. The first leads that we're gonna typically put on are gonna be the arm and leg leads. If your patient is typically a little bit hairier, you can either change your leads or you can shave the arm or leg areas, kind of give you some more skin contact with the leads so you get better reading on your 12 lead. So we're going to place the leads on the extremities. When you place the leads on the extremities, you want to try to put the leads at a higher portion of your bicep or arm itself. For patients that have amputations or they don't have a full extremity, you can put it closer to the clavicle area to get that extremity reading as well. So we're going to put the right leg. Now we're going to place our left lower limb. It's the same as your right lower limb. Okay, now we're going to go into our chest leads. It's important for the placement of the chest leads because you can get inaccurate readings when it comes to your 12 leads, so it's kind of important to make sure you have the proper placement. You can go ahead and place the lead 1. You're going to place that right between the midline of the sternum on the side of the sternum. So midline of the sternum on the side of the sternum. You're going to go and place lead 2 right across from it on the side of the sternum. All right, so going into the next leads that are also important to make sure they're proper placed is going to be V6. So our next preacordial lead that we're going to place is going to be V4, which is placed at the mid-clavicular line at the 5th intercostal space. So to find that, if you can find the midpoint of your clavicle and follow it down to the 5th intercostal space where V4 is placed, it'd be a lot easier to find that. After placing V4, it's easier to find V3, and V3 will be placed right between V2 and V4. Okay, after placing V3, you're gonna place V6, which is a lot easier to find, which is going to be horizontal to V4 and is located mid-axillary line. You can use the patient's underarm as a guiding point to find the mid-axillary line. Lastly, you can place V5, which is a lot easier to find. It's between 4 and 6. After placing all of your leads on your patient, you're going to ask your patient to relax as best as they can. Try not to move. Movement can hinder or mess up the EKG that you're trying to obtain. So, sir, ma'am, please just sit still for about 10 to 20 seconds while we obtain the ECG of your heart.